Namaskar, everybody. It's a pleasure being with you guys today. I think this is a landmark event of starting a Hindu Medical Association group in UK, very much needed to carry out the long tradition. So I'm going to talk about why yoga is a model of what is the modern personalized medicine, despite coming from a philosophy that's possibly 10,000 years old or maybe even older. But to bring it to the perspective, I want to give you two incidences that happened in my life. Many years back, I was called to give a talk to young kids at the University of Toronto. They had a program. They were all Indian Hindu kids, most of them below 15, 16. Most of the patient people who I spoke to said, I asked them, why did they come? They said, or why did they believe in Hinduism, or why did they do whatever they did as part of Hinduism? So these kids told me that they do it because their father do it. So their father prays, so they pray, which is not bad because these are, after all, kids. Many years later, something else happened. But at that point, I did promise myself that I need to make this clear to everybody that Hinduism and its philosophy is one thing that is most scientifically backed than any other religion in the world. And we shall talk about that today. So that no kid can say, or even grown up should say, okay, I follow Hinduism because my father is a Hindu or my mother is a Hindu, whatever. They should not only be proud that their father and mother is a Hindu, but also follow that this is one of those religions whose philosophy is possibly the most scientific and most researched in the world. So to continue my story, not really a story, a real incident, many years later, I was called to give a talk at Georgia Tech, which is in Atlanta, which is the third or maybe the fourth topmost engineering school in the US, maybe even in the world, after MIT and at Berkeley. So there, when I was invited by the organizers, the faculty, who I think was the dean, if I don't remember correctly, almost whispered into my ears that Dr. Basu Ray, we call important people every couple of months to give a talk, but just wanted to warn you that sometimes these talks, there's hardly anybody sitting there. It's empty chairs. We just have all our faculty sitting there. So please don't mind if something like that happens. So I told him that's absolutely fine. You're paying for my plane ticket, and you're paying for my stay in a 5-star hotel. I can't ask more. I don't charge for this because this is an ideology, and especially giving it to students, absolutely, I'll be more than happy. Then the D-Day came and I went for the talk. To my surprise, the whole hall was full. It was jam-packed. Kids standing in the back, some kids standing over each other, over their bags. So my topic was how you can use meditation to achieve a better memory and achieve your career goals. So I was really stunned when I saw this. I said, okay, let me ask. So without telling the real thing which the dean actually told me, I just asked the people there that I was told that these lectures are hardly attended. No student bothers to even attend. How come the hall is completely full? You know what I heard? And these are not Indian kids. They are not Hindus. None of them has ever been to India in all probability. They said, we came to see because of your topic. In the last 10 years, they have lost more than 6 to 10 kids who killed themselves, suicide, because of the stress of modern day living, because of the stress of studies. They're studying in one of the top engineering school in the country or maybe in the world. So that's the need of Hindu philosophy, to go out to people. And there where each and every one of you can play a big role. And we'll talk a little bit about that at the end of today. So yoga, as all of you know, is an ancient Indian technique of healthy living. There's extensive research in the last few decades. There's no other field of integrative and complementary medicine that has gone more research into than yoga. And we'll talk about some of them. There has been actual studies corroborating different disease and seeing how yoga works on them. So now we have a solid pathophysiological understanding. Not only that, in the last 10 years, there's been at least a couple of Nobel Prize, not directly based on yoga, but based on some of the assumptions or some of the things that we follow as part of yoga. And I'll mention maybe one or two of them. So let's dive into it. I'm going to divide this lecture into one, understanding the yoga mechanism. And I guess most of my speakers, as I've been told by Kriya ji and other people, that they're going to be doctors. So I have kept my speech at that level because it'll be too long if I try to explain everything. But in case somebody doesn't understand anything, number one, every of what I say has got uh, uh, has been referenced. So feel free to check out the references. And of course, I'm always available for any questions. So we'll talk about the yoga mechanisms, how and why yoga acts, because we still need to know more. And in fact, one of the Nobel Prize in the future years might come out of this. I don't know how many of you are clinician or practicing researchers. So that's one part of it. Then we'll talk about a few diseases. We had the great ENT surgeon talking beautifully about the need, but I can't talk about every disease. That will be a nightmare. So I'll just pick up a couple of diseases, and me being a cardiologist and cardiovascular death being the world's largest cause of death, killing twice the number of people as cancer all over the world, whether it's in UK, US, India, China, name it. So we'll talk about a couple of diseases to give you an exact example how we know even the molecular mechanism, how yoga works. And then I'm going to throw some light on research, especially newer thinking, how we need to change the entire medical concepts about research to understand yoga. So we'll talk a little bit about that. And again, feel free to ask me any questions if you have. So we need to understand the mechanistic model of yoga as a physician, because yoga or yoga therapy is something that needs to be run by a physician. Just because I can stand on my head for half an hour doesn't make me a powerful yogi. A powerful yogi is who understands the science, the biology, and the practice of yoga and its application both physiologically and pathophysiologically to the disease. And who else can do that better than people like you and me who are trained physicians? So we'll go through all these quickly so that you understand. So what yoga does to the brain has completely revolutionized medicine. And I've been lucky, as Priyaji said, I've been one of the writers of the guidelines for the world's largest organization of cardiovascular specialists, that is the American Heart Association. And one of my co-authors was a guy, David, who has got $100 million lab in Wisconsin, starting from Dalai Lama. He's put functional MRIs, CT scan, EEG leads into everybody's head to find out a bunch of Hindu and Buddhist monks. So now we know yoga induces massive changes in the brain. It completely changes neuronal chemistry. If you are depressed, you'll stop getting depressed. If you are stressed out, you'll stop getting stressed out. It changes the brain parameter of activity. If you are depressed, if your amygdala and hypothalamus are constantly activated, being depressed, emotionally challenged, that will change with just 4 weeks of yoga practice. You can create a new brain. That is a revolution in medicine. For 2000 years, we are told brain never creates a new brain. Whatever you have, it's like an ATM. Whatever money you put that's the money you're going to get back. ATM doesn't produce money for you. That's now no more true. You can change your brain in 4 weeks. You can change the chemistry of the brain. If you're a guy who's always stressed out, if you're a guy who's always depressed, you're going to be a changed person in 4 weeks. And we have some more deep questions that has been first answered in Hindu philosophy through Upanishad, and now we are getting light into it. For example, we now know if you have 60,000 hours of meditation, you can generate what is known as gamma waves. So what are gamma waves? These are waves. I don't want to go to all the waves because being physicians, most of you might know. If not, just you can revise, open up Google and you'll get the answers. But most of us generally have what is called beta waves that keeps us awake. But when we concentrate, we go into alpha waves. But people who are meditating, they can go into deeper waves like gamma and theta waves. So gamma waves are waves in active meditators for ages. So imagine if 60,000 hours can give you gamma waves, which now some people believe, people who are studying consciousness, that gamma wave is the way you understand the universe better. Because that is the basic, maybe the basic way for consciousness, though that's a controversial, that's a little bit of a controversy. And if you can prove it, you'll get a Nobel Prize. But having said that, if this is what just 20 to 30,000 hours of meditation can give you, imagine the minds of philosophers in India like Ram Krishna, Swami Vivekananda, or imagine their power. They could go into what we call samadhi. The exact English word for that, according to me, would be changing your level of consciousness. What would be the power of their brain? Now that we are understanding the brain without invasive, with non-invasive procedures like functional MRI, radioligand tagging, we know the massive changes that is occurring through yoga and meditation. So these are the changes in the brain. I talked about the waves. So this wave is very important because you have to remember, the cooler your brain gets, the more anxiety, the more stress you get, that leads to disease. So as you can change the activity of your brain through practice of meditation, you reach higher and higher level of concentration, which not only changes the entire biochemistry of your brain, but your entire physical biochemistry. And we'll talk a little bit about that more as we go through other slides. So after 2000 years of medicine and a bunch of writing multiple volumes that brain doesn't change, now we know that's all nonsense. You can completely change your brain. The mTOR signaling pathway we now know can actually cause generation of new brain cells, changing the brain neurotransmitters so that you get a more powerful brain. Sarah Laser, one of my colleagues at Harvard, she showed in 2010 that if you practice meditation for 10 years, you'll get your brain 1 inch bigger. The cerebral cortex, the top part of your brain, which we have as humans, that will increase. And being doctors, you guys know this. Whole of the Western world, I think same with UK, US, we have at least 20 to 35% of the population at 85 years of age or older, languishing in nursing homes. They do not know their name. They do not know who their son is. They do not know where they should live. That's dementia. We have no medicine for dementia. We have 3 drugs which hardly work. Just now, FDA approved a drug which is super costly. It's little better than a placebo. The situation got so bad that out of the 11 people in the committee, 5 of them resigned after the drug was approved by FDA. And FDA had to come out with a disclaimer and say that dementia is such a bad situation. It is almost like an epidemic. And since we have no treatment, we didn't have an option but let this drug go and allow the drug to be used by people. It's even worse than cancer. At least in cancers, we have so much good treatment now. So you don't need to go to a doctor. You don't need to have $1 million drug. You can sit at your home and make sure that the rest of your life, you never ever develop dementia. So the mTOR signaling is an important pathway for that. Then you have the sirtuinin 1 signaling pathways, which does a bunch of things. Number 1, it also indirectly activates the mTOR pathway that increases creation of new brain cells, changes the brain neurochemistry, but also it increases BDNF inside your brain. When you do radioligand, as you can see in this picture, I have given you the references. And remember, none of these references, if you look carefully, are from Hindus or from guys like you and me who could be biased. They are from people who are neither Hindus, never been to India, have no clue what Hinduism is. They are just scientists. So that's the level of research we need to show to the world that Hinduism had for the last 10,000 years. And now science has the capacity to prove it. And people who are proving it are not biased Hindus like you and me, if at all. I mean, you might say that I'm not biased, so am I, but that's what the world would say if this research was done by you and me. But this research was done keeping the highest notion of research by people who don't even understand all these things. So it increases BDNF, and a bunch of other genetic factors take place, and I'll be explaining. BDNF, as you guys know, is brain-derived neurotrophic factor that causes development of brain cells. It has been shown in vivo, as in vitro, as well as in vivo using radioligands, a part of which you see in this particular paper. So it's also important to understand how and why yoga works. Today we have 2000, more than 100 Nobel Prizes in medicine. We know the molecular mechanism of a bunch of things. Still, the number of deaths due to cardiovascular disease is increasing. Why? What is the answer? Where have we missed? Where we missed is we are forgetting the main cause. Today you have a heart attack. There's a bunch of nice drugs that prevent you from getting another heart attack. But will it make your chance of heart attack zero? No. Why? The reason is we still don't have a drug that will completely negate your stress. You might have antiplatelets, you might have anti-cholesterol, you might have every anti known to mankind. But unfortunately, there's only one anti to stress, and that is practice of yoga and meditation. And I'll come to that. So why is the autonomic nervous system important? It is very important to understand the basic concept that we as humans, when you get up in the morning, you get to see your wife, your children, your father and mother. That's not what we did for 10,000 years or for maybe a million years. When you got up in the morning, our predecessor might have seen a huge anaconda trying to slither into his cave, or a saber-toothed tiger waiting to greet him as he just steps out of his cave. Or maybe a mammoth waiting to crush him the moment he leaves his cave, his home in the deep forest. So whatever our predecessors did, and they could do only two things, either fight and kill that animal or run for their lives. Whatever they did, they must have done the right thing. And that's why you and I, our species, are dominating on the earth today. If they haven't done this, somebody else would have dominated and I wouldn't be here talking to you. So the autonomic nervous system for the last 4 million years is geared to this fight or flight response. That's how your ANS works. So when I am jealous of you because you are a more brilliant doctor than me, my brain doesn't understand jealousy. My muscles don't understand jealousy. My muscle understands that you are it's funny, but that's the truth. You are something that is scary to me. I need to treat you. But the unfortunate part is neither I nor you are a dinosaur that I can go and eat you up. So what damage can I do to you? Nothing. But what damage can I do to myself? A bunch. So when you have this jealousy or these sort of pattern, when I'm anxious, when I'm depressed, what it does is unfortunately, the body goes to its primitive mode of flight and fight response and releases a bunch of chemicals, as we'll talk about. The sympathetic system is accentuated. The parasympathetic is pushed down. So you have release of dangerous chemicals like interleukin-1, interleukin-6. What killed these millions of people in COVID? Not the COVID virus. It is you and me releasing interleukin-6. That causes the lungs to be damaged. That causes the TNF-alpha, interleukin-6. That's what killed. So you did land up killing the virus, but you also landed up killing yourself. So it is the abnormal immunity generated by stress, generated by autonomic nervous system activation that leads to it. It's very important to understand if we need to understand the science behind it. So when sympathetic nervous system is activated, it could be very frivolous thing. You just got a brand new car and I couldn't afford one. You got a raise in your job, I couldn't get one. You as a physician, I think I'm more brilliant than you, but you have a better practice than me, despite I think you're a dumb guy. So these are minimal things, but you have to understand as physician, scientist, as a common man, that your nerves, your brain, those billions of neurons that you have, which is more than number of stars in our galaxy, don't understand any of these nuances. They understand, are you in trouble or not? Yes, you're in trouble. Why? Because you got a raise and I did not get a raise. That's why I'm in trouble. Why? You have a better car, I didn't have a better car. It's as stupid as that, but you have to understand the mechanism of bodily function to understand why yoga works where modern medicine has failed. So when sympathetic is stimulated, because that running that you had to do, our predecessors had to do from that saber to the tiger or the anaconda needed blood in the muscles. So you don't need to run away from the guy you're jealous, but that's the only reaction you will have when you are having jealousy in your mind, when you have stress in your mind, when you're nervous, when you're drinking too much and stuff like that. So that's important to understand. Now, along with that, the entire HPA axis is activated. because they need to make your heart go from 70 beats per minute to 200 beats per minute. Only then heart will supply enough blood to your legs, and so that you can run. It will supply less blood to your kidneys because your kidney doesn't need it, but your muscles need it. It will supply less blood to your brain because they don't need it. It will supply less blood to your bone marrow, but it will supply blood to your muscles. So when I am jealous of you, there's no need to have blood in my muscles and less blood to my brain, less blood to my kidneys. So and there's also neither any need to release cortisol, which causes all these problems, as you guys know, weakening your immune system, generating anxiousness, depression, creating other problems like stroke, and we'll talk about this, uncontrolled blood sugar, digestive things, accentuating IBS, of course, very, very high blood pressure, sometimes even malignant hypertension, not amenable to multiple drugs. And absolutely a whole plethora of heart disease, starting from Takotsubo cardiomyocarditis, that is in overnight, your normal heart with a 60-65% ejection fraction, you'll end up having 20-25% of ejection fraction, finally leading to death, unless you get a transplant or other mechanism. So these are all generated by your body. And that's where yoga comes in, because yoga blocks all these processes as we talk. Now, the problem is much more deeper than that, and this illustrates that, but I don't want to go all the details, but it actually shows that when you do have stress, your prefrontal cortex is activated by stress. Again, I've given you all the references. Feel free to go through those references. You will find that the stressor causes release of TNF alpha, interleukin 6, all the dangerous. And now we have a drug for interleukin 6, tocilizumab, but that is because of COVID. Before we didn't even have a drug. And even that drug doesn't work when your TNF 6 goes up 80, 90, 200 times, as we see in deadly COVID, especially with the Delta virus variants. So, and there's a bunch of other activation. The NK kappa beta pathway is activated. The CTRA genes are activated. We'll talk a little bit about that. There's oxidative damage to the telomerase. So you lose age. You start losing, you may be a young 60-year-old, but you look like a 90 years old because of constant stress. And we have seen the other way around. Because we have seen the other way down, now in modern medicine, we have two concepts. We have a concept of chronological aging and a concept of biological aging. Or in other words, you may be a 90-year-old guy, but you have a physique of a 60-year-old, and practicing meditation for 12 years might make you save at least 10 years of biological age. Why? Because your mechanism will be better. This is not rocket science. You don't need to be an Einstein to understand that. You got a car which you take care. It might go 200,000 miles, but still it is a brand new, it's almost like a brand new car, and you can sell it at a good price. You might mismanage your car, and that your car has got hardly 60,000 miles, but you don't get to sell it because it's a junk. So same, it's like a train wreck. The same is the human body. Human body, as Hindu philosophy says, is just a mechanism by which you carry on your thing. How you maintain this mechanism, how you maintain this car depends on you. If you maintain it appropriately, it's by reading the manual. So the manual of reading the car is like, you have a Tesla which can drive you, but you can drive the Tesla like a broken Toyota. Now it's upon you to read the manual so that you can get the Tesla to drive you. So that yoga is the manual of life. And we'll talk a little more about that, but I just wanted to show you how from aging to damage and destruction of almost everything in the body can be led by stress. So the HPA axis, of course, both there is cognitive and somatic excitation, because now we know mind body. For like 2000 years, we were told only few psychosomatic illnesses. So now we know there's nothing called psychosomatic illnesses. Every illness has got a somatic and a cognitive part. Everything is mind and body. Every second, the body is communicating with the mind. Every second, the mind is communicating with the body. And that doesn't require only the nervous system to do that, that the blood signaling mechanism, the lymphocytes, everything acts as a signaling mechanism between the brain and the body. So the HPA axis and the stimulation of the ANS that you get with stress, they're completely shut off using yoga. So with your sympathetic activity, which causes rise, as you know, of systolic blood pressure, diastolic blood pressure, heart rate, and also increases your heart rate variability, leading to massive diseases, heart failure, arrhythmic deaths, and we'll talk a bit about that. So now we know how your brain is, that's how your body is going to be. If your brain is already always stressed, that's how your body is going to be. Your body is going to break down because it's the physiological mechanisms is transformed. So your stress, your depression, your anxiety, your anger is changed to the body. I don't know how many of you know, after the 9/11 occurred in the US by a bunch of terrorists, the Twin Towers broke down. Multiple few million people got heart attacks post 9/11. Why? And there's been not one, hundreds of studies. Because TV continued to show those pictures. Multiple TV channels all over the world continued to show those pictures. So people sitting in Florida, 6,000 miles from where New York is, people sitting in Los Angeles or San Francisco, 5,000 miles away from where New York is, just by seeing the TV, they got heart attack. Yes, I'm not joking. That is the power of the mind. You have to understand that as a physician. It doesn't matter which branch of science you're practicing. Mind is extremely powerful. That's what our philosophy said. That's what yoga said. But yoga was reduced to a bunch of exercise and some nonsense ritual, thanks to the fact that modern medicine did not have the power, the tool, the gadgets to understand the effect of the power of yoga. But now we do. And now we do that this is true. So when one guy, I have people calling me and say, hey, Dr. Basu Ray, I do yoga every day. So he's a very nice young neurosurgeon. So the guy, neurosurgery, they practice 12 hours. They're like us. Once upon a time, like us. Nowadays, we don't do such long procedures inside the heart. I being a cardiac electrophysiologist, but they still do 6 hours, 8 hours of surgery. So he said, Dr. Basu Ray, I still managed to do 1 hour of yoga. So I said, that's great. So that 1 hour you'll be protected from heart attack. The next 23 hours you will not be. That's because every minute your brain is changing your body. Every minute your body is changing your brain, and a little bit about that more as we go to that. So this is shows the interaction between the hypothalamic pituitary adrenal axis and sympathetic nerve, how immune and neural mechanism are innately connected with each other. They are closely linked to each other. They are not differential systems. They are just one system, walking, talking, changing notes every second of your existence. And that's why today, if your father dies, your mother dies, you have a divorce, and you have a severe viral infection, nobody will say it's a coincidence, because there is proof that your beta cells, immunity cells come down, your T cells, your natural killer cells, their function comes down when you have emotional stress, like cancer. And those cancer patients, now we know if they are happy, if you keep them in a state of happiness, if you make them practice meditation, they not only lose the interleukin-6 and other things which actually depresses immunity, but their immunological changes in their body due to yoga can actually prevent spreading of cancer. So these are some of the things that we know now because of massive research. So again, this just repeats that, starting from CD3, CD4 cells, and CD8, which is a suppressor mechanism, those counts are decreased. CD3, CD4s are increased. Immunoglobulin A, which helps you prevent getting COVID in the first place. It is the first layer of protection that is augmented by meditation. And these are all based on actual research by people. And almost all the known inflammatory markers, all the bad guys now, whether it's interleukin-6, interleukin-1b, tumor necrosis factor, everything is reduced. You don't have to become a Ramakrishna or a Swami Vivekananda, big rishis, to do that. 3 weeks, 6 weeks, 12 weeks of practice is enough in some of these. And there's not 1, 2, or 3 studies. There's a whole bunch of studies to prove that. And in a whole bunch of cases, whether that's heart disease, whether it's cancer, whether it's psychosis, whether it's major depressive illnesses, name it, there's been proof in psychiatry. Last year, we were asked to, by one of the top journals in alternative and complementary medicine called JICM, we were asked to give an updated research on all the research in yoga. So in 1 year, we found more than 1049 papers. And it's open access in Journal of Alternate and Complementary Medicine. Feel free to go. Just type my name and you can download that free. Not only that, this is last year for just 1 year. When we wrote down the guidelines for AHA, we had to go through 4,000 articles. And 4,000 were quality articles, which we really had to go down. We possibly got down over 12,000 articles, but 3/4 of them were trash. They could not be considered to be taken for creating the guidelines. So you can imagine the amount of data that is being produced all over the world on this. So if we as physicians, Hindu physicians, are dumb to this, keep our eyes closed, behave like a horse, our eyes are closed, we can only see modern medicine, nothing else. This is modern medicine. This is the one which will give you a heart attack. This is the one you need to tell your patient to practice after they get a heart attack, they get a heart failure, they suffer from cancer. Almost all the top cancer, I don't know about the UK, but almost all the top cancer hospitals in America, and if you don't believe me, go to their website, have different departments or for teaching yoga, teaching meditation. Even some like Sloan Kettering, MD Anderson, which is #1, they have their website will tell you more about Ayurvedic drugs than any Indian who knows. I can guarantee you 90% of you will not know about Ayurvedic herbs that those cancer specialists know. Because why? Because they want these. Now it's proved that it works in cancer. There are my friend who's one of the professors at MD Anderson, world's #1 cancer hospital. He gets $5 million every couple of years just to do research on yoga in cancer patients. As you know, I do not know the cancer epidemiology in UK, but in America, in white females, the breast cancer is the #1 killer. So that's how much money he gets to teach people yoga. So it's time that we open our eyes, find out the massive power. Similarly, it changes the genetic makeup also. There are a bunch of genetic effects. I don't want to, genetic effects, we'll talk a little bit about them. One of them, is the telomere. Elizabeth Blackburn, whose picture is here, she discovered that and she got the Nobel Prize in 2009. This is one of her papers where she actually showed, along with Dean Ornish, that meditation can actually slow the rate of aging. And now we have a bunch of other articles. I talked about how a 90-year-old guy can have a younger brain because the brain cells don't die. Similarly, there is some evidence that that aging can be decreased. There's one study with hypertension, this study with prostate cancer, a bunch of other studies. Though it's a little controversial because we still don't have the right gadgets. And I'll tell you why we don't have the right gadgets shortly, but this is what it. So these are a set of 300 genes which actually cause stress, which stress activates, called CTRA genes. And we don't have a single drug that can stop these genes. The only drug known to mankind, only way you can talk to mankind is practice of meditation and yoga. It completely inhibits the CTRA. So I will stop there to give a mechanism. Now I'll talk a little bit about the different diseases. Again, being a cardiologist, I have unfortunately limited it to my science because A, this is a short talk. I can't talk about everything. B, these are diseases that happens to everybody. 45% of the Earth's population have hypertension. And that's why I think this is important to say. So there are multiple meta-analyses which show yoga can not only decrease your systolic, diastolic blood pressure, revert your HRV, but also decrease the number of medications you are taking. You might start with 3 medications now with having malignant hypertension. In 2 years, you will go back to one medication. Breathing techniques like pranayama practice also increases HRV, decreases ANS activities. Again, there are not 1 or 2, hundreds of meta-analysis by some of the biggest names in the world that proves this. There are different breathing techniques, alternate nose breathing, also known as Anulom Vilom, left nostril breathing, Chandrabhed Pranayam. Just do it yourself. Take your blood pressure, take your pulse, do 12 into 5 sets of left nasal breathing. You will see your blood pressure falls and your sympathetic drive comes down, which will be shown by the fact that your pulse will come down. These are extremely powerful techniques. And this is not some illiterate sitting out in the streets telling you. And that's what I said. Yoga is not just because you can stand on your head for half an hour, you become a great yogi. These are all proved by science. So different breathing techniques have different things. Some decreases heart rate variability, some increases parasympathetic drive, decreases blood pressure, does a bunch of other things. There are different breathing techniques, which I'll not go into details today, and there's all papers on each of them. And a lot of these papers are not by people from India, that they are biased, they're from others. And breathing, there are a bunch of books on slow breathing. Slow breathing was started with of pranayama. If you do pranayama, there are multiple breathing techniques, and these breathing techniques actually can completely change your physical body to a large extent. Now, couple of what is more important as physician is, I think, is the same problem in UK with the NHS and in the American system. America is the largest, richest country in the world. But what is the problem? The money required to treat epidemics of heart disease will break American Medicare system in the next 10 to 15 years. I think the same is going to be story with any medical system, whether it's Canada or England, which are all government-controlled health system. Because where will you get the money to treat billions and billions of dollars needed to treat heart disease, especially when it's an epidemic? That's where yoga comes in. It saves people. As you guys know, America spends #1 in health system. Finland and Sweden spends 40 times less than America. Where is America in the health index? America is 42nd. Where is Finland and Sweden? They are #1. Why? Because out of $1, we spend 99 cents to treat disease, not to prevent disease. Whereas Finland spends only $67 to treat disease. The rest is spent on prevention. So it's important that with the economy that we are facing, with massive COVID epidemics, where now we have enough evidence that once you have COVID, you might have very, very mild COVID, but you might still have heart disease for the next 10, 15 years. You might have heart failure. There are multiple studies on that. Anyway, I'll not go into that for today. So that's where yoga act. And the important point that I want to say is, this is something you don't have to do all your life. Just tell your patient 2 months, 6 weeks of yoga therapy can bring down some of these things. So this is which highlights the main factor, that stress acting on the brain. There's your vagal withdrawal, sympathetic activation, hypothalamic activation, and hypothalamic activation causes chronic low-grade inflammatory state, causing increased circulatory pro-inflammatory cytokines like IL-6, IL-1B, acute phase reaction, high sensitive CRP, and all those things, and they lead to heart disease. This is the actual molecular mechanism, how NF-kappa B activation pathway is activated, leading to activation of over 300 genes. And again, I've given you feel free to go and actually read the article. This is the molecular mechanism, as I said. That you don't have to go and tell people, I think yoga works. You just tell people yoga works. And if somebody contends that that's not true, throw them this paper on their face. I mean, now we have molecular and genetic mechanism of understanding how stress works and how stress is brought down by yoga. This is the illustrative way of saying that every heart disease known to mankind has a stress as a component. So you have heart rate variability that is decreased. The largest cause of death in America is sudden cardiac death. Every 2 minutes, somebody is dying. By the time I started talking till now, at least 10 or 15 Americans would have died. Because you must remember, if we suppose you're in Seattle today, where the average response time to get you a helicopter or ambulance to your house, if you call the emergency number 911, is 6 minutes. Even in Seattle, 70% of people will die before they can dial that number or before an ambulance reaches their door. So imagine in other countries. In India, I have a friend who's an infectious disease guy, one of the pioneer of infectious disease in India. A couple of days back, he just died. It took him 20 minutes for the A to come and to drive him to the nearest hospital, Beach Candy Hospital, and he died on the way. So it's important to understand that time is money. This is not a disease. Stress is not a disease that you can treat. Stress is a disease that you can prevent. So that's why you can prevent those millions of deaths. Atrial fibrillation, 20% of population more than 80 years of age have it. Anywhere in the world, there are a few 20 to 25 million people all over the world having it. Myocardial infarction, massive increase in the number of NSTEMI. STEMI has decreased, but NSTEMI continues to increase. You have atherosclerotic plaque disruption causing different acute coronary syndrome, causing stroke, you have thrombus formation causing people to get their legs chopped off, in diabetes mellitus. So name it. Everything is initiated by abnormal stress causing sympathetic and HP axis activation. So this is how yoga works. I don't want to go into the details, but you have all the references here. This is by nih.gov, so it is not some private practitioner trying to sell his yoga magic to you. This is the federal government of America in their own website, how yoga practice changes all these things. As you know, 10 years back, you couldn't do a research in yoga. Now yoga is very well funded, and some of the biggest research are in yoga. Same, don't want to go to all the difference, but basically the same thing that I said, starting from changing the metabolic profile, physiologic profile, reducing inflammation, reducing oxidative stress, both in the mitochondria, outside the mitochondria, it can do everything. And we have mechanistic way how yoga does that. Even regular practice of, say, something like Surya Namaskar, it increases your capacity to, if you can do around 4 to 5 minutes, you can go to more than 12 minutes in a few weeks. It results in postponement of your anaerobic threshold, which is one of the parameters which we look for in heart failure patients. Tell me one single exercise which does that. So this is the book we were talking about. We are coming out with this book, over 75 authors from all over the world, starting from Harvard, Emory, all the rest of the world, which actually brings the science of using yoga in cardiovascular disease. Now I want to change and use the last couple of minutes to take you through where we are failing yoga in modern research and why do we need to change it. So you have to understand this. This is written by Davidson in New England Journal of Medicine, that we use RCTs and we think that's the gold standard. Is RCT the gold standard? So let me tell you something about my own practice. As you know, I get to see the most severely infected patients with 10%, 15% EF. I put in different devices because we don't have so many hearts to transplant. So we put in CRT and a bunch of other devices. So we are told there's a trial called Atlas, as most of you who are in medicine or cardiology will know, that you need to give ACE inhibitors to a dose of, say, 40 milligrams. So you give lisinopril at 40 milligrams. How many of my patients with heart failure can tolerate that? Less than 10%. So it is important to understand that a lot of our trials does not talk about reality, because the whole concept of RCT is meant for a bunch of patients who are not real, who are not the random patient who walks up in your clinic, who are not the patient referred by other cardiologists to me because I need to put in a pacemaker or an ICD or a CRT or a micra so that they can increase their medications, because nobody can even tolerate 5 milligrams of lisinopril. So what is the use of this Atlas trial done 15 years back, which says you need to put them on 40 milligrams? That's what we also talked about in our meditation clinical practice, because yoga is a subjective thing. And we'll talk a little bit about that. So randomized controlled trial are considered gold standard for clinical research. But the problem using RCTs by default is they are completely counterproductive in personalized medicine. Why? This is the reason. RCT lacks generalizability to the patient population, which is outside the study. So Atlas had 3,000 people. In that 3,000 people, very well chosen from a few hospitals who are under total medical care, who you have followed for a long time, and you give them the medicine and say, when you give them 40 milligrams, they improve. But that's not your typical population. That's not the Tom, Dick, and Harry who walks into your clinic. So it's important to understand that it is time to stop flogging the old dying horse and putting pressure on it, because it is true, if you give an antibiotic in Antarctica or if you give an antibiotic in Mars, the result would be same. But what about the disease where a mental level plays a big activity? There, that don't work. If you're depressed today, it doesn't matter how many anti-cancer drug I give you, your metastasis will increase. And that has been proved through a bunch of trials. American oncology believes that. So being sad decreases your if your SF36 shows, or your depression index study shows, or your anxiety index study shows, you have all these three, your chance of recuperating from a cancer is much lesser than that person who is happy, who's not anxious, who's got a higher score on SF-36. This is medically proved. So it doesn't matter whether you're in Mars or whether you're in Ye, the same effect cannot be until your mind is changed. So that's what it is. It's not that the RCTs don't work. It's not that the RCTs don't work. The problem is precision medicine the disease prevention makes all the difference. So in precision medicine, mind-body balance comes through training. And that training changes how the body works. How the body works, based on that, the research, based on that is the final result. So it is much different from what we see in a normal medicine today. So to practice mindful medicine, RCTs doesn't work. There's something called the NF1 trial. This came out in New England Journal of Medicine, one of the top journals. So you guys can read about it. I was called by the Indian Science Congress to present this in 2020, and I did. I showed them why it is time that we stop flogging the old horse of RCTs, because in personalized medicine, mind plays an important role. So it does matter whether if your mind is happy or sad. Based on that will be your physical changes. Now, why is yoga important? Why you as a doctor should know this? The reason is 200 million members of this, oh my God, sorry. 200 million members suffer from this, 200 million members use mind-body intervention, use yoga. 86% of yoga practitioners use their own pocket money to use this. So we ought to be able as physicians to give them the science and understand why we are doing this. What is the science behind yoga? So my take-home message would be stress-induced chronic disease are enormous bundle on our healthcare. Stress management is a skill that can be honed through mind-body practices such as yoga. Mind-body practices for treatment of chronic disease is the only way out through the epidemic of heart disease, cancer that we are facing now, and even COVID, particularly sequel of COVID, which is completely behaves like a mind-body defect. So the attempt must be to understand the science, to press the science to the people.